Ultimately, what I want to see is the elimination of new HIV infections in the county.
Dr. David Holland is the Chief Clinical Officer for Fulton County. He and his team officially launched a PrEP clinic at their health department earlier this year. PrEP, or pre-exposure prophylaxis, is a pill taken once a day that reduces the chances of someone getting HIV by more than 90%.
We are making history. Yeah, if we are not the first, we are one of the first health departments in the South that is implementing PrEP. And how extraordinary for it to happen here, where we see such a large rate of infection, particularly among African American communities, to know that we have more than just education. We got a strategy to end the epidemic.
And last question, how will you know when you've achieved some success?
When the epidemic is over.
That's an ambitious goal, especially in the South. According to CDC, southern states are the most affected when it comes to HIV infections in the U.S. Out of the 10 states that have the highest rates of new HIV infections, 8 are in the South. Georgia is one of them. In 2014, it had the 5th highest rate of HIV infections in the country. Those numbers are reflected in Fulton County, the largest county by population in Georgia and home to Atlanta. In 2014, about 30% of all people living with HIV in Georgia lived in Fulton County. That same year, Fulton had the highest number of new HIV infections in the state, 771. The numbers get worse when you break them down by race and ethnicity. Across the South, African Americans accounted for 54% of new infections in 2014. Black men who have sex with men, 60%. Black women, 69%.
We don't want to be the new epicenter of the epidemic in the United States, and right now we're hovering around number 2. And so that's why it's so important that the PrEP clinic is coming on board, that it's going to be a huge addition to the ongoing comprehensive prevention toolbox.
There are a number of reasons why the South fares badly when it comes to HIV. Income inequality, lack of health insurance, what CDC calls cultural factors like homophobia, transphobia, racism, and general discomfort with public discussion of sexuality. And on top of all this, not enough uptake of new HIV prevention tools. Fulton County also felt the push to change their HIV prevention strategy after being called out for not spending all the money they were funded. Internal audits, which were picked up by the media in 2015, showed that Fulton had failed to spend all of its HIV prevention money. All of this attention led to changes, including new people in leadership roles at the health department.
The Fulton County HIV/AIDS Task Force was primarily formed, of course, because we knew we had reached a crisis. We had reached a critical point in many levels. The epidemiology had reached a critical point for us. The fact that our response at the county level was in disarray. The fact that our high-impact prevention program, quite frankly, was on the cutting floor, or at least on the edge of destruction, simply because of a whole lot of issues that came to play. Mostly a lack, I think, of leadership and will and attention to the critical needs that scaling up this level of high-impact prevention in our county health department required. So there were a lot of things happening all at once.
There's a lot that goes into prescribing PrEP, especially for patients who don't have health insurance. That's why Fulton County reached out to San Francisco to get a sense of how San Francisco manages its PrEP clinic. Diakima Thomas, the PrEP coordinator for Fulton, came to San Francisco City Clinic earlier this year.
So I think that the main thing that I will take back is the teamwork effort. Everybody working together to make sure that it's a success, and that none of our patients are walking out of the door with the feeling that, oh, well, they are just so separate and they're not really working together. I can feel the tension in the office versus everybody's working together and I'm getting what I need in a timely manner and I'm out the door.
The following week, staff from San Francisco headed to Fulton to train other staff.
It was a humbling experience in the sense where in San Francisco and California, we're an expanded ACA state, so we sometimes forget about the struggles and challenges of not being in those types of states. I guess the other thing would be the challenges of working in an environment where people are not always out sexually, and how that it could impact partner notification, disease detection and treatment and linkage to care.
I think today and yesterday have gone actually pretty well. Everybody seemed real receptive to the information that was being presented. They were engaged, they were participating, and they actually looked like they wanted to be here. And I mean, what really summed it all up is that they looked like they really did take something away from the training, and hopefully that just passes on to our clients, and we're better to serve them.
The population that the Fulton County PrEP clinic is aiming to serve is one that is in huge need of these services. So anything we could do to help expand PrEP access in Black MSM, particularly young Black MSM, and in Black women is great.
I think what we try to do, and I try to do in particular, is to encourage people to understand that we're a learning community and we're trying to learn from each other and try to share with each other. And I think the thing we do successfully is we go and we try to research the area that we're going to so that we're not promoting a San Francisco model, because that sometimes doesn't work for certain people or certain counties. And so what we were able to do was to say to people, we're all learning from each other, all these things are new, and we're just trying to do the best we can.
There's a collective momentum in HIV prevention, and parts of the country like New York, San Francisco, and the state of Washington are using this moment to bring an end to HIV infections. Getting to Zero campaigns are popping up across the country because now, more than ever, zero new HIV infections is an attainable reality.
With new advancements in HIV detection, prevention, and treatment, we've reached an important new moment in the fight against the HIV/AIDS epidemic.
And Fulton's staff have the grit and tenacity to take this on, because they're not taking no for an answer.
It's just very important that here in Fulton County, the staff has the interest and the energy and the ability to pull off a clinic that incorporates new technology.
What I think is most important is that we are able to, at this point, latch ourselves onto the science. And once we latch ourselves onto the science, as you can see by the energy and the representation in this room, that we then are able to build momentum around what's real.
Please continue to talk about this throughout today and this weekend as we observe National Black HIV/AIDS Awareness Day, using the hashtag #FCPrepClinic. Thank you so much.
Fulton's already making progress. Within a month of this launch, Fulton's health department connected with Morehouse College. They're now setting up a satellite PrEP clinic at Morehouse. Within Fulton's clinic, waiting times are going down. Fulton's gone from 2 weeks of waiting between someone seeing a doctor and starting on PrEP to 2 days. And they're even looking at doing pooled RNA testing in their lab.
I think that momentum is only going to grow, and the more that the community finds out about the availability of this new resource, then that's also going to drive and inspire, I hope, the community and the community providers, community health educators, AIDS service organizations, our allied organizations, to continue to push, not just for PrEP now, but there are going to consistently be new strategies coming down the pipe. And we want to make sure that we've created a structure here that can look at those things for our local population and then begin to immediately implement them so that we can further drive down the epidemic in this county.